This is Kathy Anderson, Extension Horse Specialist for the University of Nebraska. In this presentation, I'm going to go through some information to help you identify if your horse is healthy or if he's sick. So you really kind of want to do an overall health assessment to help you determine that your horse is in good health. And really, pretty much being a knowledgeable person and an observant person can really be very advantageous to you. You really want to take a close look at your horse pretty much every day and just notice some things that might be normal or abnormal. So some things we're going to address here are basically your horse's body condition score, a little bit on the behavior. You should look at any changes in their hair coat. Are their hoofs normal? A little bit on hydration. You look at their eyes and their ears. Have there been changes in the manure or their urine? Is it loose? Is it really very hard? Is he not defecating? Okay. The mucous membrane color, capillary refill time, and overall performance. And also I'll talk a little bit about how you can take your horse's vital signs. So looking at their behavior changes, really knowing the basics of your horse's normal behavior will help you realize and understand and know pretty quickly if something might not be going quite right. So, if they stand off away and isolate themselves from others, maybe that's not normal for this horse. Are they not eating as well? If they're inside, it's easy to be able to tell if they're not cleaning up their feed. If they're outside, you need to kind of look and notice, are they not coming up to eat, and those different types of things. General behavior, have they become kind of nervous or lethargy, just not doing as much? Kind of take a look at their eyes and see, are they cloudy, are they droopy, do they look like the horse just doesn't feel good? Any kind of swelling. So really just an overall good evaluation and check of those horses pretty routinely can really help you see some things early on. Anyone should know how to take their horse's vital signs, and even if you're thinking you might need to call your veterinarian, having taken their vital signs is probably one of the first things that you can help relay some important information to your veterinarian. So remember that the normal resting temperature for a horse should be 100 degrees Fahrenheit. And anytime they're, say, above 104, maybe even 103, you should start to be concerned. It's very simple to take. You're going to use a rectal thermometer and stand off to the side as this individual is doing here, and be fairly careful about going ahead and taking that horse's temperature. Sure, if it's hot, humid, if they've been working, that can influence their temperature, so take some of those things into contents when you're taking it. Another vital sign that's important to know, can tell you some things, are their heart rate. Okay, so the resting heart rate of your horse should be 30 to 40 beats per minute. Now you don't need to take this for a total minute. You can take it for 15 seconds, then multiply that by 4. So basically you're going to measure underneath, you can feel it underneath your horse's jaws. You can see the picture here. You can also have a stethoscope where you'll take it sternally, as you can see in the picture over here. This picture here is he's taking it sternally. Oops, excuse me. Also, it can be taken down there in their fetlock in this area down here. Now, you have to realize that things such as exercise, excitement, or pain will all be things that are going to increase their heart rate. So it's one of those things you can take. A horse might be in pain. They might not have a temperature, but they might have an elevated heart rate. And so those are part of the whole picture. Now, also realize that newborn foals will tend to have a little bit higher resting heart rate than your adult horses. The other vital sign that's important to understand how to take is the respiration rate. And this is 8 to 16 breaths per minute. So again, you really only need to take it for 15 seconds. So you can see that's going to be very few breaths in a 15-second time frame, and then multiply that by 4. And the respiration rate is very simple. You're really going to observe that horse breathing. And so inhale, exhale of his flank, number of times it rises and falls. You can also lay your hand over their nostril and feel how they're breathing. Okay. Just like heart rate, there's a variety of things that can increase it, from excitement, exercise, fever, hot weather, poor ventilation. Those types of things can all elevate a horse's respiration rate. Mucous membranes. You can look at your horse's mucous membranes simply by just pulling their lip up and taking a look at their gums. Okay, they should be pink and moist, and kind of look at some of those different kinds of things. You can also measure the horse's capillary refill, and basically what you're going to do is lift his lip and press onto the gums there and see how long it takes for the capillaries to refill. It's normally that it's 2 seconds or less, and so if it's longer than that, you might have some type of situation going on. If they're red, bluish, or blanched color to their gums, then that might also be something abnormal. Dehydration is something you can check to see if they're drinking or not. So by simply taking and pinching their skin to see if it goes back down in a normal amount of time. The capillary refill is something else that you can monitor to make sure to see if those horses are potentially dehydrated and not drinking very well. Body condition score is something also that you should be very aware of and be able to monitor with your horses. We talk about this in a lot of different contents, and really it's just an indicator of the horse's body fat overall their entire body. And so it's graded on a scale of 1 to 9, of 1 being extremely skinny and 1 being extremely fat, and we'd like most of our horses to kind of be in that condition of a 5 to a 6. So just to touch on this just a little bit more, we're going to look at a horse from the side view at least 10 feet away, and also we're going to palpate him and run our hands over him in the different areas, looking at the crest of the neck, the shoulders, the withers, over the ribs, down their loin, their tail head, and those different areas. Now you also have to remember that in the wintertime, a winter coat can mask what their actual body condition is, and so that's why we say it's very important that you do palpate them and run your hands over all those different locations to get the best assessment of how much fat cover they do or do not have. So the 1 to thin horses, they're going to be your extremely poor horses, kind of have that bag of bones look to them. Pretty much you're going to easily see their skeleton of their shoulder, their backbone, their ribs, throughout their hips, and there's really no fat accumulation anywhere. And so these horses, they either are being starved or have some very serious health concerns going on. A 4 is kind of like this horse here, where the ribs and vertebrae are evident and you can see them, but they still have more fat cover than those extremely skinny horses. The rib cage is going to be pretty easy to see from the side. The vertebrae will have kind of a little bit of a crease down along their back. So for a 5, you can't really see the ribs, but you can feel them. And so as we're getting into these upper condition scores, this is where it really becomes important to be able to feel and see, the difference between a 5, 6, 7, and on up. So in these 5s, there's no ridge evident on the vertebrae. You can't really see the ribs from the distance, but when you push your hands over them, they're pretty easily to feel. Okay. Excuse me. So we'd like most of our horses to be kind of in this 5 range, or potentially a 6 as this horse is here. There's a little bit of indentation along their back. There's some fat along their withers, behind their shoulder, and those kinds of areas. And again, a horse is basically going to be, as some might say, just in good flesh. Getting up into our more obese kinds of horses, really I consider 8s and 9s. They're going to have more fat deposited, and you really are going to have to run your hands over them to get a good assessment of where these horses really are at. The 8s and 9s are going to have pretty substantial pockets of fat down, in those various areas. And no matter how hard you press, you're not going to be able to feel any ribs or any of those types of things on these horses. All right. So nasal discharge is another thing to look at and notice of what might be going on with your horses. It might be just a very little bit of a discharge. It might be more substantial. You're not going to be able to say what's wrong with your horse, but it would be one part of the picture to determine that he's got some type of respiratory, some kind of issue going on. It also would be a good idea, if you see some of this, to go ahead and take your horse's temperature before you're going to call your veterinarian, so then you can give them a better picture of what all your horse is actually doing. Droopy eyes and a discharge. This can be a variety of different things. This horse on the one side, he's got some gunk, I would just say, not very scientific, but some stuff in his eyes. He could have some type of infectious type of thing going on. The one horse with his eyes closed very tightly, he could also potentially have some type of ulcer. So just taking note of what their eyes are like can help paint a picture of something that might not be going quite right with your horse. Some indicators that they're just in pain. Okay, they might be restless and paw at the ground, pace. Some will get down and thrash and roll around much more than normal. Sometimes they just have a change in attitude and they just act grumpy, uneasy, and can't relax. Some horses will just go if they're turned out and stay away from the rest of the horse. Sometimes they're going to start sweating for no apparent reason. And then also you might, if you take the vital signs, have an elevation of their heart rate, respiration rate, maybe or maybe not temperature. So here's some horses that are in some type of pain. These horses are camped out. The one with the red halter on, we don't know from the still picture if he has an issue going on with his feet, if he's kind of colicky and has a bellyache, but it's obviously he's in distress. The other horse here, that's the body clipped horse, looks to me like he's in pain in his front feet. Looks like he's kind of starting to rock back. And so, take some pictures, note some things of what might be going on in this horse. Sometimes it's an issue with their feet, and so you can look and maybe that might be what the issue is, that he's got a bad bruise, he's developed laminitis for some reason, and different kinds of things like that. Indicators that they have a bellyache or colic, they can be very, very broad ranging. It can be for just that horse is standing back, stretched out. The light colored horse here on the top, he's kicking at his belly, doesn't look very happy. He's kind of look like he's in distress. The horse on the bottom is laid down. Also listening for gut sounds can also be some indicators of some things that you might look for and watch out for. Ulcers. We have a lot of horses with ulcers. Kind of as people have learned to be able to scope horses, we understand things a whole lot more. And this can be mild, it can be very significant. The horse on the top, he's mainly just biting at his sides, and they bite at their side once. That might just be a fly or a bug. But if they start doing this more routinely and it looks like a thing of distress, then he could be colicking, he could have ulcers. There's a variety of things. Just like the horse on the bottom with his ears pinned back, he might be mad at somebody else, but also he might be having some spasmodic types of things, some pain that ulcers are causing. And so take note of these things and for sure get some assistance to try to figure out what's going on with your horse. Some other kind of general signs of illnesses or disease, they're not going to eat, taking that temperature, see what their fever might be, do they act depressed, listening to them to see if they do have different kinds of gut sounds in their intestines. Do they have any diarrhea? Okay, are they walking blindly? Just everything that you can notice about those horses. Here's something else you can look at and notice. These are horses with different degrees of strangles, and strangles or distemper, and it attacks the lymph nodes, and they'll have inflammation in their lymph nodes. All three of these horses are basically having them in their throat latch, probably in their guttural pouch area, where it's characteristic as they'll first begin to swell, and then those abscesses will burst, or you might have to have them lanced. These are not the only locations that horses can have abscesses in. They can have them underneath their jaw. I've seen them have them in their udder. So there can be a variety of other places that they have can have developed abscesses, but most commonly it's going to be up here around the throat latch, the head kind of region. So some things to do until you get the veterinary there. That you've got this horse that something's going on with you're not completely sure. Okay, so you might let the horse lay down or stand, and stand, kind of keep them comfortable. You do want to avoid them rolling. We used to say to walk those horses, and pretty much they just want to try to keep them comfortable. Many times they'll suggest that you do not give them any pain medications such as Banamine, because that can mask what's really going on with that horse. And so you need to visit with whomever you might be calling out to say, what should I do? How long should I expect? Give me some guidance here. Also, it's usually a good idea to go ahead and remove them from hay or grain, because you don't really know what's going on. And so that's, especially if it's just going to be a short term, wait before your veterinarian arrives. And so kind of work with them on some of those types of things. If you think your horse has some type of eye injury, like the eye at the top is very cloudy, some of these just have some discharge and stuff in them, most of the time the best thing you can do until your veterinarian arrives is to put them inside, keep them out of the light. It is not recommended to give them, put any kind of eye ointment in, because really your veterinarian needs to come, and they oftentimes will stain the eye, so then they can determine if there really is an ulcer or a scratch, and that will help them determine what kind of medication you really do need to give those horses. So the best thing is to get them inside, get them out of the light, and just kind of wait until your veterinarian shows up. So sometimes they're stoved up. Sometimes they've got a very swollen leg. They may or may not be lame on it. Um, so, you know, you can go ahead and take a picture. In today's day and age, some folks like you to go ahead and send them a picture of what's going on. And sometimes they'll want you to go ahead and hydro those legs, run some water on them, run some water on the knee, and keep them fairly immobilized if you can until they would show up, until they would arrive. Also, being able to determine the degree of lameness these horses are is very important. And some might be very, very lame, where they're almost three-legged, where others might be just a little bit stiff and sore. A laceration. This horse, he's got a little old laceration in the middle of his back cannon bone. So kind of, you know, the best thing is to visit with your veterinarian, maybe send them a picture. Sometimes they really don't want you to apply any medications. Sometimes you have a very good relationship and they'll have you go ahead and treat them. So it's just kind of vary. You know, sometimes they'll have penetrating objects and we say don't remove them. It can be a situation that maybe you do need to remove them. So think pretty carefully about those types of things. And you know, you might want to go ahead and apply a bandage to help if it's bleeding. And so be kind of careful about how you do some of those different types of things. So this is just a few tips to help you identify a healthy or sick horse. And probably the most important thing is you notice them always, you take a look at them, you're very much aware if something's right or wrong. And then if something doesn't appear right, go ahead and call your veterinarian as quickly as you can so that they can come and help you in a timely manner and get your horse back on the good spot.